Hi, I'm Peter Remfrey, the CEO of the Workers Health Centre based at Parramatta and Newcastle. This video was developed to provide you with current information to improve your health, your well-being and to live a better and happier life. Further information, including links to support services, can be found on our website. This will assist you and help you, your family and your workmates.
My name's Alan, I'm a registered nurse. I've been nursing for almost 45 years, I should say. Mostly in the areas of mental health, plus also drug and alcohol, because they go hand in hand. Currently, I'm a clinical nurse consultant in dual diagnosis, which is mental health and drug and alcohol, and also an authorised nurse practitioner. With addiction can occur to anybody. It can either be something that can be due to environmental, chemical imbalance in the brain, people will be drawn to the drug of choice, or could also be exposure in their lives and what's available to them. And they also believe that some people will use medications to self-medicate, manage themselves and to cope with their current life stressors. At the moment, cannabis is used quite a lot, and that's our most used drug. There are other drugs at the moment. Methamphetamine is increasing because it's actually getting cheaper than other substances. It's freely available. We also have alcohol, cigarettes, and the other issue that in some communities is a major concern is also gambling, which is an addiction which sometimes people don't associate gambling with drug and alcohol. The health impacts for alcohol are extensive. They can range from, if we have somebody that's a social drinker, might just binge drink once or twice a week or even a month. There's issues of damage to their reputation, there's issues of criminal activity, DUI, might actually be exploited, risk of sexual abuse if they're intoxicated, they drink to blackout. There's a whole lot of risks at that beginning spectrum. Then at the end of that, where somebody's been extensively and heavily drinking for a long period of time, we're going to find people with marked neurological changes, brain damage, physical neurological changes, organ changes, changes in their blood chemistry and how their body responds. We're even going to find cardiac changes, seizures, the list just goes on. And again, these are things that are preventable, that sadly people at the time, their over-addiction and urges to drink overrides their capacity and ability to make that informed decision to prevent them drinking heavier or more. We know that 61% of hospital admissions are due to alcohol misuse. If one person has a substance abuse issue or gambling issue, that has a ripple effect to the other people they're connected with. Substance addiction is treatable. It's a journey of recovery that sometimes has many lapses and relapses for people. Some people can go to a counsellor or detox, first admission, and then they will be able to move on with their life. Some people will lapse or relapse continuously depending upon their support system, changing their lifestyle, the stresses or difficulties that are happening with them. And that's where we need to also look at their mental health that's underpinning this. Because if we're not able to address the issues and the stresses they're experiencing, we're not able to reduce their alcohol use and to stop that. So it can be a very challenging and difficult journey, but it is something that can be done. We have great services available here in New South Wales. We have great health services, we have great GPs, we have great non-government NGOs that provide service for people with addiction problems. Speaking to somebody else who specialises in that area is always important, and they'll give you the right information, connect you to the right person, and if the person does have gambling or addiction problems, they also have great support networks for families and carers of people whose family members are experiencing this on how to cope, survive and give them the best support possible for treatment and recovery. If we can look at getting change, we can then start treatment. Most models work on the AA model where the person has to self-refer, want treatment, or come to you seeking help, and that is when we can start making positive change. We don't have a magic wand. That's where we need to connect with them, try to shift with their thinking, look at other options of treatment, are there legal issues, and worst case scenarios of do we need to look at other options of involuntary admissions, which is a last resort, or can we look at other things such as detox admissions, residential rehabs, long-term counselling, and if there's criminal activity, we can also request that the magistrate orders treatment, and we can provide that. It's important to get early treatment because if we don't get treatment and the condition deteriorates, we have many irreversible long-term damage caused to that person. A sad example is somebody that's drank excessively who then comes to detox, has to stay for 4 weeks involuntarily, and we then perform neuropsychological assessment on them, and that person actually has brain damage that's irreversible. So we then have to look at other options of treatment and management for that person, which includes accommodation, financial orders, and that person requires a guardian to look after them for the rest of their life. And that's sad to see somebody get to that stage where if we could have gotten in earlier, that's great. If we could have shifted that person's thinking and had them engaged with us earlier, we might be able to prevent that happening. I feel that if anybody is concerned about their addictions, if anybody's family members are concerned about them or it's impacting on the quality of your life, please give somebody a call. On our website we have a whole lot of resources available of professionals can assist you, and there's no shame. They're there to help, to assist to return the quality of life to you, to address your current addiction issues. Unless you've seen people with addictions or experienced yourself, it is one of the hardest things to break away from. But we know that if people accept help, if their loved ones support them, we have a whole service, a whole team that are here to help them and walk that journey with them, and will support them till the end of that journey. And also give them support on preventing relapse and lapsing in the future, and that's available through services such as AA, NA, Gambling's Anonymous. There's a whole lot of great services out there that can help people to be abstinent and to stay away from their gambling and prevent lapsing in the future.
I'm a peer worker, so I'm in recovery from mental health issues and drug and alcohol substances abuse, and I come to work and I'm just basically there so that they have somebody who understands completely what's going on. I can understand somebody who's talking to themselves and pacing the hallway. I can understand that it's mental health problems as well. I can understand all of that stuff. And that's basically why I'm there. I'm 45. I have a grown son who has 2 sons of his own. I'm a recovering drug addict, alcoholic, and I have mental health issues. Well, I dissociate, so it's scary and painful, very painful. So I can have things going on in my head that are absolute fiction. But back then, when I was very unwell, I couldn't determine fact from fiction. So I literally could not determine what was real and what wasn't. Now that I'm in recovery, I can do that. I can determine what's going on and what isn't. I can identify this is not really happening, but it's real for me and it hurts. So please talk to me, or please help me medicate myself or something like that. Constantly reach out. That would help. I do that every day now. I reach out constantly to just about everybody in my life. And honesty, I have to be honest. So when I was not being completely honest with doctors and my family and stuff, it didn't pan out right. It was, I was unwell. They took my son a couple of times. I got well, they gave him back. I became unwell again. I ended up sending him to live with his grandparents because I felt that he was extremely unsafe with me and I couldn't look after him. So I don't think he understands that it was for his own benefit. but now we have some sort of a relationship where we're well aware of what Mum's been through. We're a little bit accepting of it now, and they trust me. They trust me with their kids, and now that I'm a lot better and in recovery, yeah, that's the biggest thing in my life, being trusted to seek help. Not everybody has a family. Reach out to somebody. Somebody is going to answer the phone. Somebody is going to be there. Not really sure who, but somebody will. There is help, lots of help available. Well, I'd like to say that being in recovery has changed my life dramatically. So I work now as a peer worker in drug and alcohol, but I work with people who are mentally ill also and have dual diagnosis. I hope that I can help just one person. If I can help one person, just by being able to understand, then I've succeeded, I'm successful. Mostly the involuntary drug and alcohol treatment team, they set me up for life. They set me up with a psychiatrist and a psychologist and mental health nurse. They set me up with all sorts of services that helped me with everything. Where I was living, I changed that because I followed their direction. I just did what I was told a lot because I decided that they knew what was best for me. I couldn't make that decision anymore. And when I did that, things changed. To reach out and find somebody who can hook you up with services. There's many available. I couldn't think or function. My family had me committed to a drug and alcohol treatment facility, but because they treated my mental health as well, and set me up with all the services so that when I left there, I was set up to succeed, I did. I had to trust somebody.
Thanks so much for watching. We hope this was valuable for you. Further information and resources are available from our website.